Hi everyone, my name is Maria Drummond and I was a PhD student at the University of Glasgow. I was supervised by Professor Bridget Johnson and Dr Terry Quinn. So today I'm going to talk about community involvement and the role that had in my PhD. So my PhD looked at the demographics of people in Glasgow who care for family members and friends with life-limiting conditions. They're often referred to as carers or unpaid carers, informal carers or caregivers. I also looked at the types of services and interventions that were available to them, how those services and interventions measured their success, and then I spoke to caregivers through focus groups and interviews to try and identify what was missing from what was available. Once all that was done, I made lots of different recommendations for practice for professionals, for social workers, nurses and doctors, and suggested future research for other interventions. So I had community volunteers involved with my PhD because my research is underpinned by the transformative paradigm that's outlined by Donna Mertens, and she encourages researchers who are interested in marginalised groups to acknowledge that we benefit in our lives from the struggles that the marginalised groups experience. And it's about making sure we have community volunteers involved in our research and that we give back as much as possible. But community involvement, patient and public involvement, it's a requirement for all PhD students that are supervised by Professor Bridget Johnson as well. All the PhD students that started at the same time as me that were supervised by Bridget held a public event where we looked for community volunteers to work with us on our projects. So we advertised on social media, we put adverts up in supermarkets and community centres, and then we pitched our PhDs to the volunteers who came along, and then they picked whatever project they were interested in. So I ended up working with 3 volunteers. The first 2 volunteers lived in England and cared for family members with dementia, and they found out about my project on social media. And the third volunteer was from the public event, and he cared for his wife following a stroke, who also had diabetes, and she moved into a care home where she died. So the volunteers were involved in all different parts of my project. The first 2 volunteers, because they lived in England and it was really just telephone conversations we had, I was able to discuss more developed ideas with them and get feedback from them at that kind of stage of the decision-making process. Whereas the third volunteer, who lived in Glasgow, we met face-to-face in cafes, and he could give me as much time as he had available that day. So he was around to help me bounce quite early ideas off of him. He helped with the arrangements for the focus groups and the interviews, to help me consider access arrangements for the meetings, and then he helped with the data analysis, and when I started to identify themes, he helped me with that as well. So COVID-19 was a bit of a spanner in the works for the volunteers. The first 2 volunteers, for various reasons, couldn't continue with the project, and the third volunteer, we moved from face-to-face to email and text message because of a disability he's got. He prefers written communication if he can't do face-to-face. And that was quite challenging because at that point I was doing data analysis and I was sending him themes and quotes, and at one point he went quiet, and I didn't really know what was going on. Obviously everyone's worried about people at that point in the pandemic. So after a few weeks I gave him a wee nudge and found out that actually he'd had quite an emotional response to some of the data that he'd been reading and the themes that were coming out from that, and that wasn't something that we had anticipated because until that point we'd been meeting face to face. So that was a big learning curve for everybody involved, kind of being just a wee bit more careful about how we communicate with people and the kind of support that we're available to give when communication changed in such a drastic way. So to summarise, the community volunteers in my project, it was a fantastic experience. It helped me to feel more confident about the decisions and the findings and recommendations that I made, and it helped me to build relationships with people who are just genuinely interested in my research. You know, they're not nurses, I'm a nurse, not researchers, not academics, just people really interested in trying to make the lives of caregivers better. I think that's me. Right, thanks.